All right. Thank you all for joining us today. This is Oregon's 1115 Medicaid waiver webinar on our health-related social needs partner work session. And in fact, health-related social needs HRSN services partner work session is what that probably should say, but it was already becoming a mouthful. Today is February 13th. And we have some exciting updates to give you all and really looking forward to having a good conversation. My name is Jessica Diaz. I use she, her pronouns, and I work for the Oregon Health Authority. I'm looking off to the side because my notes are not where my camera is. My apologies there. I'm going to skip through the Zoom links because we just shared that before starting the recording. And we do have an opening activity before we get into our agenda and our topics for today. We have a few polls. We have 3 polls, in fact. I think a few encapsulates just around 3. So we'll have 3 polls to put up, and Trevor's going to help me do that. Trevor, if you can put up the one about geography, let's get started there. And so these are polls that are populated within Zoom. So once this goes live, you will see a box pop up and it will say what, I think we're starting with sectors, my apologies. So the first question is, what sectors are you aligned to? And you have options. There's internal to state work, agency internal. There's community-based organizations and community partners. We have CCOs. We have climate partners, equity partners / priority population. That includes culturally specific organizations. If you do not have an affiliation with an organization and are here as a member of the general public, we also have healthcare providers, behavioral health providers, sorry, it says partners, providers, partners, housing partners. If you are a legislator or a member of a committee, local government, nutrition providers, if you are an OHP member, if you are a member of an oversight board or committee, if you are a member of if you work for a tribe or a tribal serving organization. One is to be determined, so please don't select that one. And then finally, other. And we're at about 67, 68% participation, so I'm going to hold steady for a couple more, maybe a minute. I know we actively have people still joining us, so that is for folks who are just now joining us, we are starting with a quick poll. There are 3 questions. We're on question number 1, which is to try to get a feel for which sectors, what types of organizations, what types of participants we have here today. And there's a breakdown of many different types to choose from. And I think we're just about getting to, we're above 70%. I think that's good. Oh, so I'll move us to the next, or Trevor, can you move us to the next poll? Also, I want to thank you all for participating. We're trying to collect some information in a new way. So thank you for your patience and thank you for your participation. Now it looks like we're at the next question, which is what county or counties do you serve or reside in? This should have all 36 counties as well as a statewide or not applicable option. We're trying to get a feel for what the geographic representation we have in these meetings. And so this is really helpful for us as we look to see if there are any gaps, any places we should be finding more folks to get broader representation across the state of Oregon in this and other engagement opportunities. And for folks who are just joining us, I recognize it, my bill intends to be dropped immediately into a poll. but we are looking for what county or counties you either live in or you at your organization actively serve. And we have every county in Oregon, as well as statewide. And if you're here because you're interested, but you do not actually work in Oregon, then there's a not applicable in NA at the very end for you. It's going to give maybe 20 more seconds for folks to participate in the poll. Okay. I think we're ready for our final poll question. Oh, and thank you so much to our interpreter for putting a note into the chat. Our final question, we're trying to get a feel for who here is in an organization that is already enrolled as a Medicaid provider. And so if you have access to the provider portal, if you or someone else in your organization actively bills Medicaid right now, you would select yes. If you are at an organization or perhaps not in an organization at all, if you do not know, or if you are not representing an organization, please select the I am not sure. And if your organization is not currently enrolled to provide services through Medicaid and to bill for Medicaid services, you would select no. And it looks like we have a pretty good mix of folks. I'm gonna hold this open for another few seconds. And also to take another opportunity to say, hi, welcome new folks. We've had people continue to join us. We just got started. We're doing a few polls in advance of really digging into our topic for today. And I think we can go ahead and end the poll. And as an added bonus, I don't think we have time to really spend a lot of time looking at that, but I will gladly share it with you next time. We will crunch those numbers and we'll bring it back to you all so you can get a feel for where you all collectively are from and the sectors that you're in, and that question about who is and who isn't currently working in an organization that bills Medicaid. It looked like it was about 1/3 of folks are a part of an organization that is a Medicaid enrolled provider, and that leaves about 2/3 who are not. And if you have any pointers for if this was a positive, negative, or neutral experience to answer those poll questions, really happy to collect that feedback as well. I do want to note that in our January session, for folks who are here, we started collecting some survey responses. That survey just closed late last week, so we'll have the analysis of those survey results available for you all very soon too, and we're looking forward to seeing how we can implement that feedback that you all gave us about these sessions. Another last piece before we really dive into new content is we shared these group agreements in January, and I just want to continue to put them on the screen as we get started. I'm not going to read all of them out loud. It does look like we have some folks who are in our whiteboard. So Trevor, if you can maybe clean up the whiteboard or the annotation, but that's neat. I didn't know we had that functionality turned on. And if there's anything that anyone would like to add or change with our group agreements, feel free to reach out in the chat outside of this meeting or in a direct message to me, and we will see about any edits or changes that would make this a valuable space for you all, and a place where you all feel you are able to meet these practices, all of us together, and goals. And with that, we're at our agenda for today. So I have a quick agenda item, which is just to go quickly through some background information to make sure we're all on the same page, give some high-level updates, and with some help from my friends too, around what's happening right now with the waiver. And then the main thing we're focusing on today is walking through a health-related social needs services provider journey. And what that means is it's a document that has steps that you go through as a provider to become a provider, all the way through successfully billing for services. This is a document that we're really excited to share with you and get your feedback on. But first, I'll go through the background. And I'm going to go through this fairly quickly, but if you have additional questions or thoughts, please feel free to use the chat. Want to make sure that we are all speaking the same language, and I speak a language called Medicaid, so I want to make sure I do a little bit of talking plainly as we get started. When we're talking about Medicaid, it is a nationwide public health insurance coverage program for families and individuals. It is a state and federal partnership. In Oregon, we call it the Oregon Health Plan. Oregon Health Plan, you will also hear us say OHP. It's free health coverage available to individuals, including children, teens, and adults who live in Oregon and meet income and other criteria. Something to remember about Oregon Health Plan is it is always open. People can apply any time of year. And the reason we are starting with these definitions is that in order for someone to be eligible for any of the things that we talk about in this health-related social needs work session, people need to be on OHP first before we can evaluate for these other new and exciting things that we're able to offer. And we're able to offer new and exciting things because we have something called an 1115 Medicaid waiver. And so a really quick note about waivers is that mention that Medicaid is something that the federal government and state governments collaborate on. We have a standard set of rules that we follow in every state, but we also have differences in how we are able to make Medicaid work in that local context. And so one of the ways in which we can try something out new is through what is called a waiver. And so we ask the federal government for permission to change some of the rules. The federal government comes back and we have a negotiation and talk about what's possible. And then we get a 5-year period to try it out. And so right now we're in that 5-year period for one of these waiver. We sort of do them one at a time. We see what works well. Eventually, things that work well can become how we do business as usual. And we keep getting opportunities to innovate and to try new things. And so you are here with us in a space where we are trying new things as a Medicaid program. And then to round out the definitions, talking very quickly about health-related social needs, which is a phrase you have heard me say a few times already today. You will see the acronym HRSN. There's the big picture health-related social needs, which is anything at all that you need or an individual needs to be able to maintain their health and well-being. And so there are many things that contribute to someone's health and well-being that are outside of the doctor's office. There are 4 things specifically that in this round of the waiver, we are able to focus on, and that's housing, nutrition, climate, and then outreach and engagement. So there's my background. There's the definitions just to make sure we start in the same place. Also have a quick set of updates for you all. We are very close to community capacity building funds, that application process opening. And we're also very close to climate benefits launching. And so I have one slide briefly to talk about community capacity building funds, and then I'm actually going to phone a friend, Amelia, to talk about the climate benefits, just to make sure we have an opportunity to say this before March. So first off, community capacity building funds. We want to point you towards a variety of resources, and you can get to all of these things through the main Community Capacity Building Funds website, which is right up there at the very top of this slide. We have an updated protocol that has all of the, I like to call it all the weeds of how this all is working. There is an email address to reach folks at the state, reach folks at the Oregon Health Authority if you have any questions, concerns, thoughts around these community capacity building funds. We do also now have on the website a point of contact for every single CCO listed. So there are really great resources locally. Goodness, I can't talk today. Locally, as well as your friends here at OHA. And then I believe some aspects of this are coming soon and some are currently on the website. We have a lot of resources, a template. I believe the resources, many of them are now available in multiple languages. And this is one of those places where if you come back in a couple of days, there could be even more for you. So just really want to point towards that website. And really want to make sure that you all are people who we think are really good candidates for applying for these funds, especially the folks who listed when we talked about sectors, nutrition, housing, climate. But I don't want to forget about outreach and engagement, which is really a really important benefit as well. But I'm not here to talk about that today. So if you have questions about community capacity building funds, your best resource are the folks who are on the other side of that inbox, ccbf.info@oha.oregon.gov. And Amelia, it's your turn.
It's my turn. Thank you, Jessica. Good afternoon, everyone. I am Amelia Reynolds. I use she, her pronouns, and I work on the climate benefit underneath the health-related social needs. And so I wanted to talk a little bit about the climate benefit, which is going live March 1st. So we've been talking about these benefits for a while now, and March is almost here, which means we're almost at our first benefit going live, which is exciting. So let's start with what is the climate benefit? What is included under this? And then we'll go into who is eligible. And again, this is more of a high-level overview to kind of prepare us for the conversation of what does it look like to be a provider for this type of benefit. So under the climate benefit, folks who are determined eligible have the ability and may be eligible to receive one of these 5 device types. These include air conditioners. These are specifically geared towards folks who have health conditions that might be made worse by our heat waves, which we've been seeing a few more of in the last few years. The second device type is air filtration devices. These are those portable in-home air cleaners that help filter out things like wildfire smoke. And then what's exciting is these next 3 devices are devices that we've not had a program for before. This includes mini refrigerators, and these are meant for folks who might use medications that require refrigeration and not have refrigeration or setup that is sufficient or works well enough for this. So an example here might be somebody who uses insulin and needs a place to store that at a consistent temperature. We also have added portable heaters. This is also geared towards folks who might not have access to consistent or heat that works well enough. And this is another portable device. We're looking at these portable plugins. And then the last device type is what we call portable power supplies. This might include things like a gas generator, but it also includes larger battery backup systems. And these are meant for folks who use durable medical equipment and rely on those to maintain their health and well-being. So those are the 5 devices that folks could be eligible for underneath this benefit. And then we'll go into the next slide and talk about who is eligible for these devices. So this is the eligibility criteria. Because this is under Medicaid and the health-related social needs, the number one thing here that we have to go through first is to make sure that folks are a current Oregon Health Plan member. So that's going to be step one. Step two is that we need to make sure that someone is in one of the transition populations. That's what's displayed on the screen, but I'll go through each one individually verbally. So individuals who are in one of these eligible groups. The first one is adults or youth who have been discharged within the past year from a mental health or substance use disorder institution for mental disease. These institutions are really the 16 or more bed. These are the larger facilities to help kind of describe the type of location that we're talking about there. The second group of eligible individuals are adults or youth who have been released within the last year from incarceration. The third group is that anyone who's been involved in the child welfare system at some point in their life. So this means somebody who might be in their 40s now, but was involved as a child in the child welfare system remains eligible. So it's at any point that they were involved. Within the next, this one's confusing, so I'll do my best here. Within the next 3 months or past 9 months, transitioning from Medicaid only to dual coverage. This means receiving both Medicaid and Medicare benefits. So really it's this, that year of transition with the 9 months before and then 3 months after this actual transition, folks receive notice that they'll be making that transition in many cases. So that one's kind of weird, but it is overall a 12-month window, much like the other categories. The fifth group of individuals that will be eligible starting March 1st, individuals who are homeless or at risk of becoming homeless. We followed the HUD, Housing and Urban Development. We followed their federal definition for those terms. That's often a question. And then the last group that's listed here on this slide is young adults aged 19 to 26 with special healthcare needs. This group will be phased in starting in 2025, but we just like to mention it to know that in 2025, that's an additional group that will be eligible. And so just to kind of do a real quick recap before we move on, step one, need to be an OHP enrolled member, either with a coordinated care organization or an open card. Next is be one, just anyone, could be both, could be a couple, but any one of these eligible groups. And then you need to have what I was talking about with the devices is some sort of clinical risk or thing that makes one of those devices appropriate for you. That means that you might be eligible for an AC unit or all 5 devices, depending on health conditions and what you're working towards to maintain health and well-being. So I know that's a lot of information, but that's the quick high-level overview of the benefit that's going live March 1st. So I'll pause there.
Thank you so much, Amelia. And now, do I understand correctly, this slide that we're on right now, it talks about things that will be true across the different health-related social needs services, but today we are talking climate?
There's some, not particularly, no. So this is where each benefit is going to have its own eligibility criteria when it comes to the eligible groups, and then that clinical risk that I was talking about. What's true for all of the benefits is that you must follow the same pattern. So you must be currently an Oregon Health Plan member. You must fall into an eligible group. The eligible groups might be prioritized differently based on the benefit. So climate is starting with these 5, and then in 2025, we'll have WISHN, or the young adults with special healthcare needs. Housing is going to focus on a more narrow group because of the scale. And then the clinical risk, that is really service specific. So the clinical risk ties specifically to a climate device. It'll be a different health risk or clinical risk for housing and nutrition. But great question.
Thank you. And then we do have, yeah, thank you, Sarah. I'm realizing I could have clarified that in the title. We are talking about climate for this slide specifically today. I can promise you all that we will come back and be talking about housing and nutrition specifics later on in the year as well. And that's a great recommendation. And I see a lot of questions. I know that we have a lot to go over today that is not focused on this. I want to make sure that we collect these questions. And I think some of this we will begin to talk about, not the specifics around climate devices, but some of the pathways. We're going to begin that conversation. We go through the provider journey and continue to build that out together. I'm going to pause. Amelia, are there any things in the chat right now that you have quick,
Yes,
definitive answers for?
I
And I'll let
can.
you do that.
I can probably take like 3 of these questions really quickly and give answers to them. I think I covered some of them in my presentation, but I'm totally good to repeat because that is a lot of information that I threw out all at once. So regarding the climate devices, yes, somebody could potentially be eligible for 1 or all 5 for whatever devices they are eligible for because of their clinical risk. You know, there are lots of examples, but you might have a chronic lung condition and have a need for a refrigerated medication. Great, we could go for air filtration device and a mini refrigerator. It's really whatever the member's health needs align. So 1 or all, or a combination of 2 or 3. So yes, that's for a household can qualify for like 3 different device types. Covered this is for climate specifically, and we updated the slide real quick. Nice job. And then this is one of the limitations I see here of where all humans would need air conditioners at 110 degrees or above. It still is tied to the eligible group and then the clinical risk. So that is what's available under specifically this HRSN Medicaid benefit. There might be other programs that are available that can provide these devices as well, but we're really focusing on this as the tool that is offered to us under the Medicaid benefits and the HRSN services. And then the last thing that I'll say is for who defines or determines the clinical risks, we do allow for self-attestation. This is something that can be worked on either with, say, if you're an HRSN service provider and you're helping somebody navigate the process with their coordinated care organization or their open card care coordination team. Self-attestation is an allowable pathway for both the eligible populations and the clinical risk. So it doesn't have to come from a clinician. So somebody wouldn't have to start a new process to, say, get the official diagnosis for the chronic lung condition to begin the process. We do allow for self-attestation there. We have, and sorry, I said it was the last thing. We provide a list of examples of clinical risk that will be available. It's not an exhaustive list, but we are providing examples as a starting point, and these will be shared with providers, with coordinated care organizations, with our contractor who serves open card. So this information's out there, but it's not strictly limited to any like list that we've created. We do want it to allow for flexibility and a conversation with the member on what their needs represent. And that's where I'll stop.
Thank you, Amelia. George, I see your hand is raised. And it looks like you're on mute right now. I'm sorry, George, if you're trying to speak with us, we can't hear you.
Can you hear me now?
Yes.
Okay. With all this going on, have you guys been received anything from Washington, D.C.? the new CMS dual eligible ideas that are coming out, the new rules?
Right now,
Because they're going to be changing some more rules on the Medicaid side. A proposal has come up for the health and human service idea. There's new regulations coming out from DC.
I would say from my perspective, and I think you're looking at the dot point that talks about Medicaid and Medicare dual coverage. As long as people are duly eligible, we are interested in considering them eligible. So if the mechanisms at a federal level or even at the state level change for that, just know that what we are concerned with is that within the next 3 months or past 9 months, did people transition or are they about to transition into having both Medicaid and Medicare? And so other things may change, but this is the sort of the box that the federal government has built with us for how we consider climate service eligibility right now. I don't know if that helps.
Well, I guess what I'm getting at is, are you guys receiving any word or have received any emails from Washington DC about these changes that's coming?
I have not personally, but I can ask around.
Okay, I'm just wondering because I'm getting the changes coming in my email that I get.
Ah.
I'm wondering.
Thank you.
Okay.
Thanks, George. I realize that we always have more to talk about than we have time for. And so I hate to move forward. I think we were able to answer most questions, and we are definitely recording all of the questions. Is it all right if I move us from climate towards, okay. I am going to move us forward and to thank Amelia. Thank you so much. I think you may hear from Amelia again later on. But for now, I'll take the helm back for a few slides, and then I'll phone another friend. And that is dug up an old slide to share again, just to remind us all that we have goals for how we deliver these health-related social needs services. We know that there is this process of people need to be screened, they need to be referred to the correct services. We need to have a CCO or our open card contractor authorize and determine eligibility. There needs to be a connection to whoever is providing these services. And we need to ultimately meet people's needs. And so here's our ideal flow. I worked with some folks to put together a definition of a health-related social needs service provider. And our HRSN providers, HRN service providers, are organizations that provide health-related social needs services in a way that is culturally and linguistically appropriate, responsive, and trauma-informed. There are a few things that we have in these dot points, I think, that are really important, which is that there is a process by which we need to know that these providers are out there, whether that is us at the state or individual CCOs. So there is the process of becoming enrolled or contracted. There are provider qualifications. And then once an organization is enrolled as a health-related social needs service provider, that's when you can start billing for these services. So must be enrolled and the services must be live. And that's where we start to get into the conversation of how do we bill for these services? And we have some pieces of that puzzle today in the provider journey document that we'll be sharing. And this is the point where I say, hi, Charissa, would you like to introduce yourself?
Jessica, thank you. Good afternoon, everyone. I am Charissa Young-White. My pronouns are she, her, hers. I am a maybe middle-aged, although I don't really like to use that term. I'm a middle-aged white woman with brown hair. I wear glasses, and I'm wearing a black blazer today. I'm going to ask for some grace as I move through this because I'm really brand new to the Oregon Health Authority. And this is my first time talking to all you folks in this partner work session as well. And I'm really glad to be here. So today we're going to go through a provider journey. This is a document that was intended to be a sort of a steps at a glance. How do we go from enrolling as an HRSN service provider to building, to providing these services, engaging with our coordinated care organization, or perhaps the open card care coordinators or service providers. And it's meant to be as simple. Everything is complex around this topic, we know, but it's meant to be as simple and as easy to understand as possible. So as we go through this, we're really interested in finding out what is most helpful in this document, what things are missing, where could we build up a little bit, where could we make it simpler, where could we make it stronger, all of those things. Are there other resources that we're not providing you that you could let us know that you need? Although, of course, we don't know what we don't know. So we are providing quite a bit of other resources around this. This is not intended to be the only document that helps HRSN service provider go through this process. There is intended to be other documents supporting this. This is, I think, 14 pages long, maybe a little less. So it's not short, but it's also not a 50-page, 100-page document that you have to parse through. We really want an HRSN service provider to be able to pick out the places that they can really navigate to in this document to say, okay, here's what I need to work on next, and here's how I do it, and here's how it gets me to that place. So if you want to go to the next slide here. Oh, one thing that I forgot, please put your questions in chat if you want, but if you want to raise your hand while I'm talking, I'm totally fine being interrupted at any point. So I just really want to make this a conversation as much as possible. I'm also going to pause between either some major key points or between slides to make sure that we're addressing what we need to address. Also, I'm trying not to talk super fast, but I am a little nervous. So I might talk a little fast. So feel free to please ask me to slow down as well, but I'll work on that. The document is not quite finalized. Well, it's not finalized. This is a draft. And the intention is to get a lot of people's feedback, community-based organizations and partners like you being a main component of that. So when this document is finalized, it will be sent out. And be available on the web page. Jessica, I'm sure will bring it back to this venue. Jessica, I see you nodding. I was sure of that. Thank you. Excuse me. So this is really intended to be okay, we know it's a draft. There's some pieces in here that I've heard from partners yesterday or Friday that haven't made it into being changed. So this is really an iterative document. It's a document that's ever changing. On that note, this is not the only version of this document, even once this version is finalized before the March 1st deadline. So this also will change a little bit. It will change to have a pages about housing specifically, about the nutrition benefit specifically, and it will probably change just as we hear feedback and we're learning things as we go through the process. Right now, there's going to be some overall broad points on the provider journey, but there's also a couple spaces that are really climate specific. Excuse me. Okay. Next slide. Thank you. So let's just talk about navigating the document and the table of contents here. So right now you can't reach it. So we can't go in and click all the links and follow this document around, right? But on the left, all of those page numbers, those are going to be clickable. On the top right, those are going to be clickable. So home, fee for service, or open card, coordinated care organization, and then a help hint page of how to navigate. There's also pages there, you can see that there's 6 through 11 pages. That's the fee for service or open card provider journey. And then there's the coordinated care organization provider journey. So all of this stuff is clickable here. We're going to talk about the first few pages here that are just an overview. I think Jessica talked about it a little bit, but there's a lot more nuance in this one of how to become, or are you eligible to be an HRSN provider? And then we'll go through the open card or fee for service provider steps, and then this coordinated care organization or CCO, and then we'll talk about helpful links. Perfect, thank you. So I'm not going to touch on this one too much because it was talked about a little earlier in this meeting, but just as a reminder, climate supports go live on March 1st, 2024. That's very exciting. And then housing nutrition will also be available later this year and or early next year. Outreach and engagement supports are going live along with climate. Outreach and engagement means that a presumed eligible Oregon Health Plan member, that is presumed eligible for these HRSN services, I should say. You can, as a community-based organization, as long as you have followed these steps, get paid for the time you spend reaching out to them, helping connect them to resources, and navigate in general around the health-related social needs services. And then you can see, I already talked about this, but I'll just comment that that purple box or that round area with a hand shape that is clickable and can take you to outside links or different pieces of this document. Okay, so that's mainly the biggest overview part. Actually, we'll back up just one, Jessica, thank you. I wanted to pause here and see if there is anything that anybody has just overall. And thank you, Jessica. Please.
I do want to apologize. I was trying to make it bigger, but I can only do that if I hide some aspects. Yeah, no, I'm sorry. I think this is as big as I can make it.
I know it is difficult because it's in a slide and it's hard to zoom in, or I don't know that it's hard. It's not working to zoom in.
I do see we immediately got many hands. Melanie, I think you're up first.
Hi, guys. Teresa, did I just hear you say the outreach and engagement support section is going to go live about the same time as the climate supports?
Yep, it's included in the climate supports. So
fascinating. Okay.
Yeah, so we have a fee schedule in that guidance document, and we have in a guidance document that is not live yet either, but we can get that to you. I mean, as soon as possible. We know we're hitting up against this deadline, so absolutely. And just a little bit about that, I think they are in 15-minute increments, and you are able to bill, is it, oh my gosh, 5 hours of outreach and engagement, Amelia? I want to double check with you or Jessica on that. 5 hours is the max for a year for the outreach and engagement for a member.
That is only for
still a
climate
little-
benefit.
I'm still a little confused. So is the outreach and engagement, the 5 hours, directly related to the climate support?
Yes, Amelia
Okay.
just reminded me of that. Yes, that is the climate support, and the other ones that hasn't been developed yet, but that 5 hours for climate supports. Yes.
Okay, thanks so much.
Yeah.
I think the way my brain processes that is that different parts of outreach and engagement go live every time a new set of supports goes live. So it'll continue to get bigger and more robust as we go.
Thank you for that, Jessica.
Julia, I see your hand.
Yes, thank you. So is it the intention that a provider provide all of these services, or can a provider just be providing outreach and engagement as an example?
Absolutely, not expected to be one or the other. A lot of people will be specifically in one area and actually providing the service potentially. Rental assistance support, for instance, for housing later. For climate that's going live, I should use that as an example because it's going live and not the other. You could be a climate HRSN provider and have outreach and engagement as well, or one or the other. It really depends on the makeup of the community-based organization and how that works. So absolutely open on a case-by-case basis. Freya.
Hi, hello. So I'm wondering, I work in permanent supportive housing, and I'm wondering if, and that requires a disability. And so you could potentially have an entire building or half a building of people that were enrolled with OHP and had health related social needs. And I'm wondering if, like, say that we figured that out, is that something that that entire population could be served together? Or does each person have to file an individual claim and go to the place to get the air conditioner and do the things? And then my second unrelated question is, sorry, I'm thinking of like larger versus smaller CBOs and the billing, the way that the billing is happening. It looks like it's happening on an individual basis. And I'm wondering what the turnaround time is, because I know smaller CBOs really need that money as soon as possible. Thank you.
Absolutely. So the first question, I'm going to just turn it over to Amelia. Actually, I think that's the best way there. Can you serve an entire building at the same time? And what does that process look like? Amelia, you're the expert on climate. So
Yeah, thanks for that question. And feel free to jump in if I don't capture it correctly. Admittedly, when I ask two questions, sometimes my brain jumps to the second one first, and that wasn't my question. So for those that are doing climate related supports, the only, phrase it this way, many individuals who are eligible for climate related supports can likely just receive a device via direct shipment. So what providers will be involved with climate related supports might also be providing one or all of these devices. You are not required to provide all of these devices. One of the key aspects of being a climate related services provider is the ability to assist or coordinate installation of AC units. So that's one of the pieces that's really key with the climate benefit and AC units, is that they do have to be installed in a window, whether it's a portable unit that has the exhaust tube that kind of attaches to a window and might need a kit to install there, or if it's the only device that would be appropriate. We don't recommend window units if we can avoid them, because they're a little bit trickier. But if somebody needs help installing the window, installation is covered under this benefit. And so that is something that we're looking for support with from providers, or a provider who can maybe hire a vendor or work there. So you don't have to necessarily be able to supply directly all of the device types. And it might be where the coordinated care organization actually is ordering and shipping the device, and it's just that installation of AC units that might be necessary. And I'll answer a frequently asked question here preemptively, just because I'm on it. Under this benefit specifically, we are limited to installation for AC units, but we know that folks might need assistance with some of these other devices as well. The reality is we'll have to find separate funding streams to possibly support with assistance in installing those. So I know that there's some nuance there in funding streams, but installation of climate means AC units is what is covered under this benefit specifically. I'll pause there.
thank you so much, Amelia. That was really helpful. The second question, we're actually going to get to the time limits that coordinated care organizations and the open card or fee for service folks have. So I'm going to save that for later, if that's okay, Freya. George, looks like you're next.
Yes, what you guys have lined up here on, especially with housing supports, how are you going to enter that into how rent keeps going up? And it keeps going up and keeps going up. Who actually will pay for the larger amount? Since there's no bill in the legislature that will bring down that high rent down to its low level? How is that all going to come together?
That's a wonderful question, George, and that is a big picture system-wide question that we need to take into account. Absolutely. I can only speak to this benefit here that is coming up, and what the Oregon Health Authority will pay for an Oregon Health Plan member that's eligible for rent is the cost of their rent per month. And that's going to be, obviously, they'll pay, not obviously, but like we're talking about, paid through the coordinated care organization and the fee for service provider. If anybody else has any insight on that question here, but I think I can't really speak to the rest of your question today. That's a big, big, big question.
I know this is a non-answer and I hate giving non-answers, but what we're looking at today has really been optimized and we've really focused on what's going live in March. So there you will find there are gaps in this document that we are actively working on and we'll bring back to you. So that's my not answer, but pointing towards more future answers that we're really hoping to bring to you well in advance of, for instance, November, which is go live for those housing supports.
Thanks, Jessica. Laura, and then Chris.
Hey, thanks very much for this presentation. I have maybe a three-part question. So we are an existing Medicaid provider, and I'm wondering, particularly around the outreach and engagement supports, is there a separate registration for each of the health-related social needs? Like if you're a provider, would you need to register under climate supports and under housing and under the nutrition benefit to participate in the outreach and engagement? You know, just as an example, we have community health workers. Is this something that they could bill by reaching out to clients that they would think are eligible for, you know, one or any of these? Is there anything in particular they will have to do to register? And then I guess the second part of that question is, will CCOs be doing anything proactively in terms of outreach and engagement related to clients who might be eligible?
Great questions, love them. First of all, no, once you're enrolled as an HRSN service provider and you have outreach and engagement under your belt, you can do it for any of the three, absolutely. And the second question is, whoa, I lost it. Can you repeat your second question?
Yeah, no worries. It was about CCOs and if they would be doing anything in particular to do the outreach and engagement for their members who might be eligible.
Absolutely. Thank you so much. Yes, the CCOs are required to proactively outreach and engage their folks. And they often will be able, it depends on the region a little bit and the way the community-based organization partnerships are made up and who they are reaching, but they are required to reach out to priority populations, so historically marginalized communities, and they are required to have their care coordinators reach out to folks during possible emergencies, not emergencies, I should stay away from that language, I apologize, urgencies of needs. So absolutely, they are required to do that.
Great, thanks so much.
Clarify anything that I said. I wasn't super articulate there, so. Okay,
You're
great.
doing great, Charissa.
Thanks.
Chris. And then maybe we move forward too, because I know that we're on slide 3 of 18, and I want to make sure we get to those too.
Okay, I'll try and make this quick. I just want to make sure I'm understanding everything correctly. So I work for an agency and we run micro shelter communities for unsheltered people and try to facilitate getting into housing. We provide heaters, AC units, XYZ, but we're often having to replace them. For us to access this support, it would be for the individual and not necessarily for the program, correct?
Yes. Yes,
Okay.
This is an individual benefit for an Oregon Health Plan member that of course fits the eligibility criteria.
Okay, cool, thanks.
Yep, absolutely. All right, let's go to the next slide. I see another comment in the chat. I think we're gonna get there a little bit, Abby, but if not, I'll make sure and come back to it, okay? So next page, I think we've already kind of talked about this, but who is involved? This is intended to help an HRSN service provider. Just take a look and say, okay, I'm a service provider. I'm going to work with vendors. I'm going to work with the people that are eligible, with coordinated care organizations and fee-for-service providers, especially those care coordinators that are doing that work of resource navigation for the members. And then community connectors. So I want to stop on community connectors a little bit though. So these are folks, actually, probably a lot of you on this call are community connectors. These are folks that are already out there in the community, and hopefully we will be able to, at the Oregon Health Authority, at the CCOs, pass resources on to them so these people can help members get to the services that they need. So a lot of this is where the outreach and engagement might fit. You might have a community connector, though, that doesn't actually become an HRSN service provider because they're already part of the state network, though, for instance. So we have a community partner outreach program at the Oregon Health Authority, for instance, known as CPOP. Those folks can help our members and help our community partners connect to services. So that's just a really important piece here, and they could help them fill out forms. They could help community-based organizations reach out to certain members. The hope here, I think, is to really create a network of people that are building nets around our high-risk, high-need folks, these eligible populations or this transition population. Okay, next slide, please. Okay, so here's where the journey starts. And I want to be really clear on this page that this is not a one or the other. This is not, I'm going to be a fee-for-service provider and serve open card members or fee-for-service members or CCO. You're very encouraged as a community-based organization to enroll as both. So it doesn't require two fully different enrollment steps though. So the encouragement from us here at OHA is to apply as a fee-for-service provider. And you'll work directly with the Oregon Health Authority on connecting there. And we'll go into that in depth. And then contacting your CCO and saying, I'm enrolled. And now what do I need to go through with you with your steps to become an HRSN service provider? So these are clickable here. You can go to one or the other. If you don't think you have any members on open card or fee for service, you can go directly to your coordinated care organization as well. And thank you so much, Jessica, for the chat. I think that is really important. There is going to be links to one-pagers. And so even in the beginning, there's also going to be another eligibility one-pager that you'll be able to link to say, okay, here are the people that are eligible. I serve these people. I know I do. I should continue moving on in the process.
I'm also going to add, I think the answer here is I want to serve OHP members as well, since the next step is around enrolling. So I serve or am seeking to serve folks, I think is also included here.
That's absolutely true. Yes. And I wanted to answer Anna's question in the chat. I don't think it's necessarily going to come up later. Can a hospital be a service provider? And I don't think there are limitations on who can be an HRSN service provider, as long as they do fit the qualification to being a provider. And then of course we have trauma-informed care and being culturally responsive. I mean, I'm not saying there's no qualifications. I don't think there's a limitation on the type of organization. Amelia or Jessica, can you verify that for me?
I would need to phone a smarter friend to answer definitively.
Okay, I should have, yeah, let's just keep that one on the parking lot to follow up with later, if that's okay.
Absolutely.
Thank you. Okay, next slide, please. Okay, so we're going to go through first the fee for service or open card, and then you can see on the bottom right there that you can also click ahead to get to the CCO provider steps. And you can also, you see the not the title, the table of contents sort of toolbar at the top right to hopefully help navigate around. So we're going to go through each of these in a little bit more detail. We're going to enroll as an HRSN provider, receive the referral and provide services, submit invoice for payment and hopefully get paid, and then maintain your enrollment, or should you need to disenroll as well. So let's go to step one, enrolling as an HRSN provider. So this page is really about clicking on these links and getting over to the fee-for-service third-party contractor. So you can review the information as well, or you can call OHA to ask questions. That's always helpful. And then you can also access some other resources here. So this isn't intended to be a totally in detail step-by-step. Okay, I click this link, I need to do this, but it will take you to the links that walks you through how to do that. So you will get access to eventually, not right on this page when you're on this step, but as you enroll, you'll get access to what's called MMIS, Medicaid Management Information System. It's a cloud-based online portal, and that's where you'll do things like submit a claim and or invoices. It's a claims agreement with the fee-for-service has to be signed, so it really is a claim, but it's not a claim in the medicalization way. So you are going to have potentially a procedure code and a diagnosis code, but your CCO is going to also help you get to that space, or I'm sorry, the fee-for-service provider is going to help you get to that space as well to make sure, or the member is going to self-attest like Amelia talked to you about earlier. So this is the first step to being able to say, okay, I can be an HRSN service provider, and then we go to the next one here. And this is where you can see exactly what you need to do to go through the process. So you can talk to the fee-for-service program and make sure that they are enrolled in the fee-for-service program. You can also talk to your current clientele, the current folks you serve, and say, hey, I see that you have a need here. How can we get you into this process? What will happen then is you'll actually fill out a request form. The member can also fill this out with you, by the way, so you work with them to submit this form or something that captures the information in the form. There's also going to be a link to this form as well here in this document. We don't have that quite ready yet. Like I said, this is pretty drafty. So you'll fill out a form, and then you'll send it to the fee-for-service program provider. And it has all the information of how to do that there. So then that fee-for-service provider is going to look at it. They're going to double check and make sure it's an Oregon Health Plan member and make sure it's an eligible person. And then that care coordinator would be on the other side there. And they would authorize the service or deny the service. So if they authorize the service, they will actually contact the person. They will contact that member and say, yes, you are authorized for service. So here, if you're an outreach and engagement partner, you might not be providing, say, an air conditioner. And so the fee-for-service program will work with the member to get them that air conditioner and deliver that. Then we will also, the fee-for-service provider will also contact the member and give them all the information they need should they be denied for a service as well, which is very important. They have the right to appeal, they have the right to a hearing, etc. So for outreach and engagement, you can help them do all of these things and you can bill after you're enrolled in there. I'm going to turn it over because we're going to go to the next slide, which is actually that right side of the page. You kind of click over and Amelia is going to talk about specific climate services here. And we're talking about climate, just to be reminded here.
Right, apologies. I'm getting my camera back on and it's taking a second, as is always with toggling between screens on Zoom. All right, so to focus here on what it looks like for climate, I'll focus on climate again. That is the benefit that's going live. I am the climate subject matter expert here, so we're not diving into housing or nutrition yet because those benefits are not live yet, and we don't have all the details worked out. We have most of the details worked out for climate that's going live in a couple of weeks. So when an individual, as Tris has already been covering, is going through this process from the provider side, what this looks like is that we've already confirmed that somebody is enrolled in the Oregon Health Plan, and that they are eligible for one of these benefits. So this is where we might need to send a request on to a provider to actually deliver these services to the member. And this is also where the bit of the closed loop referral comes in to make sure that the services are provided to the individual and that everyone is made aware of that process. So as we walk through this, I'll kind of use an example that somebody has been determined eligible for an air conditioning device. They might have some mobility needs. That means that they are not able to install the air conditioning unit independently. Common. So somebody is approved for an air conditioning device, and they're going to need to work with an HRSN provider to help figure out how to receive and install this air conditioner. So if it's going through a coordinated care organization or for an open card member, this individual will be referred on to a provider. The provider will need to actually accept and confirm that they're going to fulfill this request. This is when they will coordinate the, say, installation with the member, and then also need to send back to the coordinated care or the open card contractor that they are completing this request. We don't want this request to get picked up by multiple, this referral to get picked up by multiple organizations. It needs to be approved by just one. And then the individual will actually, you'll actually go assist them, have the air conditioner unit installed, and then notify back to whoever referred this individual on that service has been delivered and completed. There is some additional information here, and I think there was a question earlier about replacements and repairs of devices, knowing that this is something that takes place. So I mentioned in some of the previous parts of the presentation that there are situations where the coordinated care organization or open card contractor might just order the device directly. For many of these devices, they do have 3 to 5 year warranties on them, using the example again of air conditioners. And in rare occasions, but we've seen it happen when you order 5,000, there's one device inevitably that shows up and just doesn't work from day one. Whoever actually placed the order for that device is going to be really key in helping problem solve getting a replacement or a repair or something like that. So if it was the coordinated care organization that purchased the device, they'll likely have the proof of purchase and warranty information. There might be some extra coordination that happens here. We know that this is a new and possibly extra step, and it might be a challenge, but just want to walk through the process and know that there is a pathway to help members problem solve this. If the referral from the coordinated care organization, again, these pathways are not exhaustive. So there's lots of ways that this service delivery might look. I'm just trying to hit key examples. So one was the healthcare organization orders the device. It is also possible that the provider would purchase the device themselves and help the individual install it or deliver it to them. If that were the case, and say you were the providing organization that purchased the air conditioner and it didn't work upon arrival, or in 3 or 4 months it stopped working, that's where the responsibility really lies to help kind of problem solve with the member, to just assist them in navigating what can be complex processes with warranty or replacement to help do this. We don't want to see a situation where a device doesn't work and we just immediately throw it away and send another one. We are looking for the pathways for repair or replacement when possible. The last thing that I'll mention here is that it's a little bit of, say, like device maintenance. But one of the things that is included in these devices is for those air filtration devices. They do have easy, in most of the models out there that meet our kind of specification guidelines. Open the case, pull out the filter, replace a new one. Pretty simple, but those replacement filters are a covered cost. So if they are eligible for an air filtration device and they continue with their eligibility, they are eligible for replacement filters up to 3 times per year during that eligibility window. So those are some of the things that might exist. And then I'll also just note that if folks are assisting with climate services and maybe notice that folks might benefit from other available services, that is a role of that outreach engagement piece, possibly to connect folks to other benefits like SNAP. So I think I covered that little process there, and we'll pause for a moment.
Oh, thanks, Amelia. That was really great. And thanks for that last point, that this can be used to connect to other resources as needed. It's intended to be an entry point for some folks that we don't see very often. I want to address the chat quickly. So first of all, I want to go up and talk to Devin asked, my agency is already a Medicaid or Oregon Health Plan provider. Do we need to enroll as a HRSN provider separately? And the answer is unfortunately yes. So in order to receive payment as a health-related social needs provider, you do need to go through this enrollment process. However, if you're already a provider, it does make this a little bit simpler on the back end, probably. So you'll be able to get a unique provider ID through this process pretty simply and be able to bill. So I wanted to make sure and answer that. And then I want to talk a little bit about the closed loop referral system, talking in the chat. So I probably will need to defer to somebody else on the call or potentially save it for later. For the fee-for-service, these community information exchange or these closed loop referral platforms for social determinants of health, to my understanding, is not being used, and it does need to be phone, email, or fax. But the coordinated care organization, that piece is, we'll talk about that in just a second, but there's closed loop referrals through community information exchange, very possible there, and it'll probably depend a little bit on the CCO. So is there anybody on the call that can talk a little bit more from a fee-for-service perspective on actually receiving and closing the loop on these referrals?
I feel like whenever I chime in, I have the non-answer answer, which is, I do know when it comes to CIE or those community information exchanges, I think that's what that acronym means. That is where we are hoping to go, but there's not a requirement to immediately be participating in one of those. And so there are different ways in which we are building. For instance, I see that I have magic information you don't have, which is I see submit invoices, the next slide that's coming. And so there are some aspects of this that we're able to put into place more rapidly than the complete beautiful solution we want to work towards. So I think there are a few steps along the way. And that's my answer that doesn't really provide any details that you can work with, but at least gives you a little bit of the vision for, we know we have to start where we're at, and we know we want to go to a place that has a really robust, good system for everyone, and that we hope you all will be with us as we build that together over the next few months. That's the closest thing I have to an answer.
Thank you. George, your question. Your hand has been up. Thank you for your patience.
Yeah, how will a consumer get, once they apply and everything and they get a referral, how will they get a notification that they've been approved through CCO on this stuff? because of the AI being more out there and hackers trying to get into special information on people. How's that all going to come together?
Absolutely. So for the fee for service, right now, it's through these phone, email, or fax. That's how they get the response. And they close the loop on that. And the member is informed. And that is a person. That is a care coordinator, and that's a person on the other side. That's same with the coordinated care organizations. The care coordinator will be responsible for screening the member and helping the member and engaging with member. And that will be a person. That won't be any AI on the other end. So there might be letters that are sort of form letters or templates, but it's definitely, there's always a person on the other side. Does that answer your question?
No. How are they going to receive notifications that they have been approved? Are they going to be receiving it through an email, through mail? Are they going to be receiving it through text?
I see. I understand. It could be actually any of those on the CCO side, and I believe it's phone, email, or fax on the fee for service side, and that is based on the member's preference. So the member, when they're asking for these services, will say, I want to be called, or I want to be emailed for these services. Fax is probably a little bit more unlikely, but it's possible. So that would be the member is being outreached in the way that they prefer the most. That would be the idea.
And I'm here to have another annoying answer, which is that next month we'll be talking about the member journey. So those details aren't here, but there is going to be a lot more information like this that we're sharing in March. We come back and have a similar document, but that isn't geared towards the providers. It's geared towards that experience that the member should expect and to help walk them through it. So there may be some things that we don't have good answers for today that we will show you in a month. I know, non-answer.
Thank you, though.
Can I make a recommendation?
Sure.
For better upgrade experience for a consumer to be notified, I think in my personal opinion, the CCOs should, if they're going to do it on text and email, should come out with a signified long number or a short number where they will be notified ahead of time. So then when they get notified, they'll know who sent that notification through text and email.
That is super helpful. Yes, I know that I don't like getting numbers that I don't know texting me. In fact, a lot of times I just delete it or even block numbers. So thank you so much for that. We will definitely take that back when we're talking about the member journey.
Okay.
Thank you. All right, next slide, please. All right, so submitting the invoice for the fee for service. You're submitting, it's called ALIN, and that is through a variety of methods depending on the community-based organization's preference. So it can be via email, via US Post Office or other mail, or it can be a secure file transfer portal that's often called SFTP, and that's just a cloud-based portal that you can put that you can send directly to them, and then you do get paid. And then I wanted to address the question in the chat. When you say billing, is billing Medicaid or billing the Oregon Health Authority? Is the Oregon Health Authority contracts with this external partner or contractor rather for fee for service, but the funds are coming from the Medicaid program. So the Oregon Health Authority runs the Medicaid program. So I would kind of look at that as kind of synonymous unless there's some nuance there that I am missing. So I'd like to ask Stephanie if there's other nuance or any OHA person on the call to make sure we answer that one correctly.
You know, I'm here with the same answer I keep having, but this time I get to say on February 27th, we are planning a provider enrollment, invoicing, and billing technical assistance forum. And I think that's exactly where we can answer, and our smart friends who know that way more than I do will be there. And also, I believe the contractor themselves, so we can ask the folks directly about how that is going to look and what the opportunities are there. And I have a slide for it at the end of this presentation, but just know that I will absolutely drop that information into the chat for you all. And that was one of the things I was really excited to share at the end, but now I'm talking about it early, just to let you all know that there's that as well.
Absolutely. Thank you. And the other questions in the chat about upfront for outreach and engagement, yes, that is true. For devices, etc., or housing, that may or may not be true. I'm going to defer housing absolutely for a while, as we're still working on housing to go live later this fall. And for climate, it would really depend on the vendors you're working with and the relationship there. But more to come on that as well. Duly noted. Okay, let's go to the last step on fee for service. Oh, wait, go back to that one on 3. I'm sorry. The expectation, I wanted to make sure, I thought it was actually on this slide. I wanted to call out because I said I would come back to this. Freya asked this question before. The expectation is invoices are paid within 30 days back to the community-based organization. That is true for fee for service. That is the expectation. There could be times, if you look at this, that you need to correct it and resubmit it. If there was a potential error or an eligibility concern, of course, there's some room for that. But for clean invoices that eligible member, pretty straightforward, those should be processed and paid within 30 days. Okay, so now let's go to step 4. And this is basically maintaining enrollment. Every 5 years, you'll need to check and make sure that all the information is up to date and correct, and you're still providing these services. So there's a little bit of a different process for medical providers, and that's just making sure they continue to be licensed and certified. And then if you want to disenroll, that's pretty straightforward. You can send an email to provider enrollment, and you do have to make sure it's a signed letter. So a letter that is signed by someone that has that ability or those rights in your organization requesting to be disenrolled. So this is the last step here for this particular document. And as you can see, you can move home, you can go visit resources, helpful links, which is the last page, or go straight to the CCO provider steps. Okay, so this is a similar process. There's some nuances, but I think we'll probably have answered a lot of the questions that we've talked about so far, at least in this. Excuse me, allergies, you know, we got that. I don't know why. It's only early February, but there must be a lot of pollen or dust out there. So a lot of people are having allergy things, and I'm going to sneeze. One second.
Salud.
Of course. Oh, yep. Okay, so this is for a coordinated care organization. So you might come to this step without having done any of the other steps. You might have gone through that fee for service process and already be enrolled as a fee for service provider and have a little number here. So we're gonna start. We'll go to the next slide, please. But we're gonna start with just saying, okay, you're going to contact your coordinated care organization either way. So if you have gone through the fee for service process, the CCO will know that. They'll be able to look you up and they'll say, okay, here, now you're going to join our process here. So this is going to leave a gap for a lot of folks, and we do apologize in some ways. Each coordinated care organization could be enrolling providers a little bit differently. You will likely have a contract with the CCOs that you work with, and if you cover more than one region, or if there's more than one CCO in your area, you may have different contracts with each CCO. So what we do here is we connect you to the CCO. There is, when you click on that link, it doesn't work for us right now, but it's already posted online. Or you could, actually, will you click on that? Because the comment that I have here is that there will generally be a web page up. Most CCOs have a web page up, but there is a person on the other side of this as well. So you should be able to pick which CCO you're in and be able to contact them. And if you don't know, the service area is on this page for any of them. So if you click on them, it says, okay, what counties were in there. And then also, if you go to the top of this list, there's also a map. So view a map of Oregon CCOs, because maybe you don't want to click through all, is it 15 or 16 we have now, all CCOs and find out which are in your area. So then you can just hone in on the region you're in and say, okay, I need to go to this CCO and contact them. Yeah, we can show this really quickly.
Wow, my computer doesn't. Okay, that took a long time to load.
There it goes. So let's say you are in Baker or Grant or any of those. That's pretty easy. You're in the Eastern Oregon CCO area. So then you'll go back and you'll get that contact for Eastern Oregon CCO. But if you are in, let's say Lane County, which is Eugene area, that's a little bit different because you actually have two. You have Trillium Community Health Plan and Pacific Source Community Solutions. So you'll want to probably go back to both of those. I suppose you don't have to contract with both of them, but I think that most people would probably want to make sure that any CCO member they have, they can connect with the CCO on. So that's that. We can go back to the provider journey now. Thank you. And then I haven't really mentioned this yet, but the hope is these provider tips generally on the bottom part of the page, so we have space for, really just help say, okay, I need to let my CCO in this case know that I enrolled through the fee for service. So I already have that Medicaid ID, that provider number. So hopefully they can just get me right into contracting and I don't have to answer a lot of questions about that process. So on a lot of pages, there will be a little bit of a tip there and maybe a place that leads you to another area of the document in case it's something that's helpful to you. Okay. Oh, I've been talking a lot. My voice is getting rough. This is a lot of fun though. Thank you. Next step. Okay, so this is really similar to the fee for service piece as well. So the difference is I can talk to my CCO. I can conduct outreach. So I can reach out to individuals that I know I've served maybe in the past. And I can talk to my CCO and find out how they would like me to reach out to them. I can do that on my own if I'm a community-based organization. You can really handle the outreach and bill for that. As long as they're an Oregon Health Plan member, of course, you can absolutely reach out to folks that you believe are eligible for services. You may have someone, you may talk to someone that you reach out to or that reaches out to you and they're not part of the CCO. So that step here is just pointing them back to the fee for service program if they're open card. If you have the capability, you can, because I know some people have what's called like Oregon Health Plan Assisters or Community Connectors. You could help them enroll with the Oregon Health Plan if they are not a member, for instance. You wouldn't get paid through outreach and engagement for that piece. You would get paid for if they're an Oregon Health Plan member and you think and they think they're eligible for services. But you are obviously very welcome to help people connect and move through that process as well. But as far as the outreach and engagement and the payment goes, you can help them fill out this form. You can talk to them about the services, and then you can ask them to self-attest as you fill out the form for them. You can provide the form for them. There's a lot of pieces to that where you're pretty open based on the needs of the member. There is a documentation requirement, more of that to come later. I know a lot of you are really interested in that piece, so please come to that technical meeting that Jessica put in the chat there. I think that I see February 27th. So I think that's going to be really important for a lot of folks here. And there's also going to be a link here of all the billable outreach and engagement services, what that looks like, what codes you need to use for that. It's not a 1,000-page long list. It's going to be pretty short. So hopefully that won't be super overwhelming. And then in this case, similar to fee for service, you again receive service authorization. This is now from your coordinated care organization that the member is a part of. And the care coordinator will be working with you on this piece. The CCO care coordinator will let the member know if they're eligible and help facilitate, help work through that process, potentially with you if you're also a service provider, but maybe with a different vendor or a different service provider as needed. And then this is, excuse me, this is if they're not authorized, they will get notified by mail. So they will get a piece of paper saying that the service was denied. And then you can help them with that, support them with that, get them to an appeal or hearing if they feel like that was a mistake or if there was an error. Okay, I think I talked, oh, and then helping members, the last piece, actually, if you could go back, sorry about that. There are other services through coordinated care organizations, and one of them is so similar and it's so confusing, but it's called health-related services. So it's not health-related social needs, it's just health-related services. And this is a pretty flexible funding bucket that CCOs determine based on this eligible criteria if members can receive that. That similar service or potentially even the same service, but it's a different funding bucket. We're really trying to braid all of this funding in a way to help members get what they need for their health and well-being. Okay, next one here. And this is where I'm going to turn it back over to Amelia to talk specifically about climate.
All right, sorry, I'm doing the slow Zoom likes to pause every time you hit a button. I need to wait a minute. All right. So this is for basically this is very similar to what we covered before. But this is where the CCO is same thing. They're going to have made the actual eligibility determination for this individual, this member. And they're going to authorize this service. So that's where it moves over into the referral for services again. So the CCO is going to reach out and contact we'll use the same example because in most cases, the role is really going to sit with installation for the AC because there are so many situations where somebody could just receive a direct shipment of one of these other devices. An example being our air filtration units. Usually weigh less than 15 pounds. And besides the unboxing and taking the plastic off, it is just a plug into a regular outlet and turn on. But same thing, receive the referral from the coordinated care organization, confirm that you are able to complete this request and deliver or coordinate, in some cases, the installation, say, of the AC unit. We are going for within 30 days. I think the ideal is that these would be faster. Many of these could be time sensitive, say if we were in the middle of summer. So I just want to call it out. I didn't mention it before, but if there's the ability to move more quickly, I think, especially say if it's in summer and we are reaching those 90, 100-degree days, 30 days might be a longer window than we're looking for. But deliver the services and make sure that the CCO is notified that this has been completed. Again, that's the closed loop referral piece of this. And then same thing on the assistance with replacements and repairs. In many of these cases, when it's coming directly from the coordinated care organization, it will be the care coordination team at the CCO who will have the proof of purchase and be able to assist the member in, say, calling a warranty, submitting those processes for replacement or repair. I'll add a little bit more information about replacement and repair and understanding that some folks might move or have a device damaged. And we do have the ability to do one replacement that is say not covered under warranty, or there was a situation that happened that caused the device to break or need to be left behind, there is room for a replacement device within that 36 month time period of where we usually say one device per 36 months, but there's room for a replacement in there. The member will just need to remain eligible for the services. So again, if the CCO is the one that ordered the device, they'll help coordinate the repairs and replacements. If it all goes together, that they're passing on that referral to the HRSN service provider who then purchases the device. That's again where the responsibility sits, is within the provider to do repairs and replacements. And then in this case, it would go back to the coordinated care organization to close the loop, as I already mentioned. And that, I think, is really like, it's the same process for both situations. So I have really just repeated it, which is always good for the memory to hear it twice.
Thank you so much, Amelia. I'm going to call out a couple questions in the chat quickly. And I think this is one we probably need to come back with unless someone else answers that. But the way in which the invoice is submitted affect turnaround. I think the expectation is turnaround is the same, but I can't speak to that specifically there. So that was up a little bit. And then the website about the HRSN service providers, if they're listed, Amelia or Jessica, either one, I don't know the answer to that.
I have an immediate thought, which is because the CCO is going to be, for instance, for someone who is a CCO member, their CCO is going to have the best picture of who is providing what services in their region to their members. I think it might make a lot of sense to go up the chain instead of only looking laterally. I think there are no wrong answers, but it might be really helpful to point people towards a care coordinator at their CCO or with that open card fee for service contractor who can get them immediate answers. So that would be my initial thought, but I also know there is this general interest in getting a better feel for what that landscape looks like. Amelia?
Yeah, I'll add to that. What you said is matches my understanding. If there is not already an existing list of HRSN service providers, and it is kind of built into the expectation of coordinated care organizations, as you mentioned, and I know we're going back a little bit to the other folks, but the open card teams that are the contractor who's providing care coordination for open card, that's a lot of where the responsibility lies of building these provider networks and knowing that this is a new benefit. So we are in the process of building a group of resources, groups of organizations that can support this work. And knowing that our community capacity building funds are in progress, but not, like, folks haven't received funding yet to become providers or to engage in this work. So I think what we have now will look very different than what we have, say, in January 2025. And so maybe my hope is that we could answer this question differently then and say, yes, we will have a list of HRSN specific providers in the future. But right now, that's something that's very much so in development, and I think is happening at the individual CCO and open card provider level.
Those are both really great answers, in my opinion. I love to see that. I do also love being able to connect someone to a person that maybe can help them with other resources in the medical system or without. So really depending on the member in that case. But yeah, also having a list of things, we struggle with that statewide, nationally, probably worldwide. Where are the resources and where can I go? And what's exciting for me, and especially because I get to work on it directly, is this outreach and engagement is trying to help do some of that in a small way, but we're taking steps. All right, thanks everyone. Next step, please, or slide. Great. So this is, again, submitting the invoice for payment. Little different rules and regulations than the fee for service side. So you do have a time limit for the CCOs. It needs to be submitted within 4 or so months, 120 calendar days of actually delivering that date of service, delivering the service. So outreach and engagement, it's the day or days you talked on the phone or you you help them in person. For climate, it's if you delivered the equipment that day that you delivered the equipment. This is a expectation. This is a hard and fast rule, and I think it's for all claims too. CCOs need to send out payment within 30 days of receiving that invoice. Again, there's this little nuance that if it's incorrect, then you need to resubmit. There's additional time there. But really, if for something where the member is eligible, you provided the service, it's pretty straightforward. You should get paid within those 30 days. And then, of course, you can always call the coordinated care organization. Thank you. Another pretty straightforward one is that if you need to maintain enrollment with the CCOs, you'll talk to that individual CCO. If you want to disenroll, again, you contact that CCO directly. And I think at this point, if you've had a contract with them and been working with them, you probably have that one point of contact that you can pick up the phone and call, or of course you can go back to the website and reach out to them again there if you don't remember, or if it's been 5 years, I don't know. So that would be a little different than the fee-for-service side in that the CCO is really asking you how to maintain their enrollment. You might have an annual contract. They're going to handle that in a little bit different ways statewide. Okay, let's get to the last slide and then open it up for other questions. So there's a lot of information here. So there is a HRSN webpage. There is a link to this member journey, which is sort of that other side of this. It looks a lot like this, but it is geared towards members, or it's coming hopefully from a member perspective and to help them walk through these steps. That's not quite ready yet. And then there's some other fact sheets that we've kind of alluded to. There's that guidance document for CCOs where I talked about sort of a coding and invoicing process. You can understand what all the CCOs need to adhere to, and then talk to your own CCO about their specific process. We're going to have the forms, and we're going to have one-pagers on eligibility and provider qualification, enrollment tips. There's also going to be a guide on how to enroll in that Medicaid Management Information System, or MMIS. And then we're also going to provide a couple other things like a data authorization form. Usually that's going to be a thing intended for the CCO with the member to consent to receiving services, etc. But these are all resources that anybody can use here. So that is the end of me talking at you. Let's answer. I don't see any in the chat yet, but what other questions do you have? And Jessica, I don't know what the time check is. I know this meeting goes till 3, but I don't know if you have anything else that you need to share and wrap up later either.
Yes, I have 2 whole slides at the end, so we have time. I'm going to pop up those initial questions we asked, though. Just give me a sec and I'll navigate to that screen. And would love to hear from you all. And also just really thankful that folks have been engaging us along the way and asking really great questions. And I'm attempting to do 2 things at once, and that's never good. Okay. Is it now showing the questions again? Okay, excellent. I am curious, or wait, maybe someone just unmuted. No, my apologies. I'm gonna maybe lead with a question for you all. Do you know what we are talking about when we say open card fee for service? It's totally okay if the answer is no. I have no idea what that means. All right, thank you. Thank you, people, for being brave and honest. Yes. And that is something where I pre-asked that question because it's really central to the tool, and it's a resource that we mentioned isn't in here yet, but that we are working on. And I also think it's pretty central to some of our messaging, which is that I will give my first attempt at a super quick definition, which is that in the state of Oregon, when we talk about people on the Oregon Health Plan, about 90% of people are served by coordinated care organizations, which are those regional entities that are contracted with the Oregon Health Authority to really be in charge of their regions and the members who they are directly serving in that region. It is a really big part of our Medicaid model here in Oregon, but we also need to recognize that there are about 10% of people who, for a variety of reasons, do not end up on a CCO, and they get their OHP benefits at a statewide level. And it's another contract with OHA, but also it can look pretty different for providers, and that's why we've separated these out. The goal, as we continue to build out these services, is that whether someone has a CCO or doesn't, they have the same good experience. That is our goal. And so I think that's also, and this is a soapbox and I apologize for jumping onto it, is why we have framed the provider journey as really, if you are able to enroll as a Medicaid, not as an HRSN provider through that open card system, and through CCOs, that gives you flexibility to serve different OHP members regardless of if they're on a CCO or not. And if you are able to reach out to all CCOs in your area, that even further opens up your ability to really serve everyone who's on OHP who might be seeking these services and seeking to go through that screening process. So there was my soapbox, and I see that more things have popped up while I was talking. So I will stop talking and I will take a look at the chat. Yes, as far as who is on OHP and who is on Open Card, there is a website that has live monthly information. I will dig it up so I can give you a real answer instead of one that I'm guessing.
Oops, like me, I just put a guess in. We last year we had about 1.5 million, so I went with 150,000 as the 10%. Very much a guesstimate. Thanks, Jessica, for pointing us to a real-time number. I appreciate that.
And then I also see questions around the presentation. Today's presentation is a little different because this is the first time we're sharing something that I haven't gotten the go-ahead to immediately share the source document with you because it's so much under construction. But just know that we are recording today and we'll be sending the follow-up recording. So that'll be your soonest access to this document. I know it's kind of a sneaky way to do it. And then with the understanding that very, very soon, and integrating a lot of the good stuff we heard out loud and see in the chat here, we will have a version that is ready to get out there to you all, and then probably shortly after that to our public website as well. And actually, I think, sorry, I'm going rogue for a second because I do think this is a time to pull up my what's happening next slide really quick because it is really important. I do think this document is just as Sarah said, it's a good starting point, but it doesn't have all of the granular answers you all were seeking. And so between the various tools that Teresa pointed out are going to be listed on that resource page and scattered throughout the document, we also have a technical assistance session that we are planning for February 27th that also will be recorded if you're not able to make it. That goes into a lot more of those technical details around what it looks like to enroll as a Medicaid or HRSN service provider. A lot of those pathways are very similar, which is why my brain keeps putting them together, even though they're separate entities. And also we'll have information on things like more of the details around invoicing and billing, and a lot of the things that we're like, I cannot answer today. A lot of those are going to be in this February 27th training. And if they're not there, then those are the folks who will be getting you the definitive answers as a follow-up. So I really want to point to that. I think I still have that long message copied, so I have reposted it, but we'll also send it to you as in our follow-up email, so you will have that access in your email, as well as a recording of this session. And maybe some of you already got an email. That's a great sign. I did also, yeah, so February 27th is talking about open card or fee for service. And I'll give the hope that, as it said in one of the tips on the document, being enrolled on open card is a great first step that can help facilitate some of those conversations with CCOs. But just know that we'll be talking about open card specifically on the 27th. And then I also briefly mentioned that we are planning on doing something very similar to what we did today, but really focusing in on the member experience in March. And so we have a draft document that we will, I think, fingers crossed, we might be able to share that one in advance because we'll be a little farther down the pathway of making it. But so something very similar to what we did today, but really focusing on what members' steps they can be expected to take, and then the responsibilities of providers and CCOs and open card contractors into helping make sure that they have a successful journey as they seek health-related social needs services. Whew. And y'all, this is the same slide I always post, but I do want to make sure that you all know we have a continuing external newsletter. We have our website. We have an inbox for any questions you have. And then I'm actually going to go back in time to the beginning of this presentation to pull up this slide as well on those community capacity building funds, because that's not something that we talked about in detail today. But if I have a closing statement to give you all, it is that we were hoping this provider journey walkthrough might help you all think about what it is that would help you successfully integrate into these systems, what kind of things you might want to apply for funds to set up, and to become a health-related social needs service provider ongoing. And so pointing you back to the community capacity building funds, I always notice typos as I am presenting when it is too late to quietly fix them. And so I will make sure you get all of these resources as well in that follow-up, and all the links. And you will be getting this slide deck. It'll be missing the provider journey document because that's a separate slide deck I quietly navigated to. And we don't yet have the go ahead to share that one. And we have 2 minutes left. So I want to check one last time to see if there's anything that people want to make sure we think about, talk about today in an upcoming session. I know this was a lot of talking at you, and I want to thank Charissa for doing that, and also to let you all know that we do consider this a continuing conversation with you all, and are really thankful that you're here. And I hope that you found this information useful. I know that every time more information is shared, I become aware of how many things I still need to learn myself and how many things are connected. So the member journey is going to help us, the provider journey is going to help us, and we're going to continue to have these conversations and to build. And any feedback you all can give us about where you see yourselves in this process or what you see as barriers to being part of this process. Also really, really useful, and exactly the kind of stuff we want to make sure we're getting back to the very smart people who are working very hard to build these tools and these resources and these pathways. And now that I've talked at length, thank you. I'm going to hang out for another couple minutes, but we are, March 1st is just around the corner. So the next time, well, for those of you who aren't in the technical assistance portion, you might next be talking to us when Climate has gone live. Have a great rest of your day and rest of your week, everyone. We'll see you later.